Wow, trauma. There is every single trauma that you can imagine. Traumatic experience. You get upset. PTSD is a trauma. It's an emotional trauma. Heartbreaking events is an emotional trauma. Emotional trauma causes stress. When you cause stress, you work on the limbic system and you cause inflammatory responses, because now your cortisol is going up and your epinephrine is going up, and all these cortisol, 30% of all the genetic material is under the influence of one hormone, cortisol. Can you imagine that 30% of your body, 1/3 of your body genome responds to the one hormone, cortisol? So imagine that. So stress can cause issues. Watch your cortisol. That's emotional trauma. Now, there is minor trauma continuously. Post-traumatic stress syndrome is one of them. Divorce is another one. Those are all the emotional ones. Now, lack of sleep is a trauma, okay? Now, one thing that is really important is actual physical trauma. Now, a lot of time you hurt your bone. That is a trauma. It triggers an inflammatory response. When you trigger an inflammatory response, it depends on where the trauma is. Is the trauma on an arm? Is the trauma on the head? Is the trauma on the skin? Is the trauma on the face? Physical trauma also triggers an inflammatory response, and it triggers an immune response. And in the beginning, it uses all the resources we have. When we are out of the resources, we start turning the DNA on, the system of the DNA, and that is what we call transcription or upregulation of some genes or downregulation of some genes, but also we make errors in the gene production. When we reproduce a cell, the cell is having a malfunction on the DNA of that new cell. So we are creating and perpetuating the problem. So trauma is key, okay? And
why is it so? This is I'm going to add another follow-up, and I think